So hello guys, so today we'll be discussing about galactorrhea. If you've been wondering why your breast is producing milk even when you're not pregnant, when you're not lactating, so that is called galactorrhea. Yes, inappropriate production of breast milk or breast milk like discharge from your breast. You're not pregnant, you're not lactating, that is, you're not breastfeeding, you don't have a baby, you're not pregnant, and you notice that your breast milk is coming out. Yes, there could be a cause. Yes. So now it can occur in both male and in female. It can also be seen in either unilateral part of the breast or in both bilateral part of the breast. So if your breast is producing milk, come closer, let me tell you why your breast is producing milk. Okay, now it could be normal, yes, physiological. It could be a normal stuff that is happening in your body, or it could be pathological. Pathological meaning that it could be an underlying medical conditions. Now, what are those things that can cause galactorrhea or inappropriate production of breast milk? One of them is hyperprolactinemia, one of the major cause of excessive production of breast milk from your breast. So now, hyperprolactinemia means when there's excessive production of prolactin. Prolactin is a hormone that is produced in the anterior pituitary gland. Yes, this gland is located somewhere at the base of the skull. So when you have excess production of this prolactin, which is a hormone, and this prolactin work in a way that is responsible for the growth of breasts in females, okay, and even in males, okay, yes, for the breast to grow. That is one of the function of that prolactin, and that function of that prolactin is to help the breast production of breast milk. Yes, so when you have that prolactin, that's the work it helps in the growth of the breast and also help in production of breast milk. Now, there's a way the prolactin works. Now, one of the major things that causes this breast milk to come out in a normal pathophysiological way, maybe let's say you're breastfeeding, okay, is when the baby is sucking your breast, okay, it send an information, a stimulation to your brain, send your information to the breast that the baby is trying to suck your breast, okay. The brain now will also send the information back to your breast, okay, to start producing breast milk. And the main hormone that is responsible for that thing is the prolactin. So when you have excess of that hormone in your body, that is what would lead to that excessive production of that breast milk, even when you're not pregnant, when you're not breastfeeding or lactating. Okay, so one of the major causes, as I said, is hyperprolactinemia, but it's a physiological thing. It can just happen, as I said, which it could be maybe pregnancy, it could be when you're breastfeeding. So it's the physiological. When that is one, then another thing again you look out for is tumors. Yes, they have tumors that can be in the hypothalamus tumors, or they could be pituitary tumors. So those tumors are things that are responsible for excessive production of that prolactin, leading to production of breast milk. So if you're producing breast milk, you have to go and check yourself to know if you have tumors, because it could be one of the reasons why you're producing excessive breast milk. And nothing again that can cause production of breast milk is just sleep. Yeah, that's why they said physiological. It's a normal thing that happens. So sleeping can also cause that excessive production of breast milk. And that one is stress. Yes, even if when they are collecting blood from your body, okay, when you go to the hospital, they want to put the needle to collect blood from your body. It can also stimulate your body to start producing breast milk. So these are physiological. Remember, as I said, pregnancy is physiological. It's one of the cause. Lactation, that is when you're breastfeeding your baby, is one of it's physiological. It's not pathological. It's not a medical problem. Sleeping is one of them. It's a normal physiological thing. Stress too. It's not like it's a deep problem, but it can also cause, it's physiological. It can cause excessive production of breast milk. One of the pathological causes of this thing, as I said, one of them is tumors in the anterior pituitary gland. Yeah. Then another thing again is if you have chronic kidney disease can also cause you to produce excessive breast milk. Okay. Then another thing again that can cause you to produce excessive breast milk is if you have chronic liver disease. Yes, if you have liver disease problem, you may likely also be producing excessive breast milk. Okay, now remember, the main thing that is responsible for that production of that breast milk is that hormone that is produced in the anterior pituitary gland. okay, known as prolactin. So the normal range is between 5 to 25. So when this thing goes above that 25, some you can see it up to 100, some 150. Once that amount is up to that level, that is when your body will start producing excessive uh, production of breast milk. And nothing again that can cause excessive production of medications. Yes, medications. One of them is antipsychotic medication like haloperidol. Yes, it's used for, now people with their head, that's one of them. Antidepressant medication when they give you, maybe say you dey too depressed, so they are giving you that medication to calm you down. Antidepressant, if you're depressed, those medications are used to elevate your mood. It's one of them. That one too can also cause excessive production of breast milk. And that one is antiemetics. All those medications they give you, you feel like nauseated or you want to vomit, and they're giving you to suppress the vomiting. That medication can also cause your breast to start producing breast milk. So if you're noticing that you're producing breast milk and you're not pregnant, you're not breastfeeding, and you've stopped breastfeeding for more than 6 months and your breast milk is still coming out, you need to go to the hospital so that they will check you properly, okay? It could be one of these causes. It could be a natural thing. Sometimes some people even get pregnant even without knowing. So you run some investigation, okay? They can also do a CT scan to be sure that you're not having any tumor, especially if the doctor could not find any particular problem that is really responsible for that excessive production of breast milk. So it's good for you to check yourself, because one of the problem that may even occur later may be infertility. Yes, infertility may come up later. Then there's what they call gynecomastia, where when men start having enlarged breasts, okay, yes, not producing production of breast milk, but when they start having enlarged, it could be one of the complications. Okay, another complication could be if the tumor is there and is not noticed on time, it could progress and get worse. So the better you go to check yourself is, most time is usually not normal if your breast milk is coming out when you're not pregnant, when you're not lactating. Okay, so thank you guys. See you some other time.